Hey everybody, it's Cheyenne and welcome back to my channel. Today is, is it part 3 or part 4? I don't remember. I want to say it's part 3. But anywho, it's my video where I go through and just read some comments that I get from you guys and try to answer your questions. And I do want to say too that I always put my email address down below, and I do have an Instagram, and I actually get lots of messages on my Instagram and through my email, and I try to respond to them. I'm sorry if I'm a little slow responding to them, but some emails contain a lot of questions, and I do work full time and blah, 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 blah. But I do really appreciate you guys reaching out to me, and I try really hard to respond to them. But anywho, so I went through and just looked at some comments, and I'm going to be answering some of your guys' questions. And don't forget to leave comments on this video, and I'll do these videos sporadically and just try to answer some questions. Is sporadically a word? Sporadically? You know what I'm saying. Anywho, this is the first one that I found, and this was actually on my Everyday I'm Sectioning video, just where I talk about sectioning. I'm not even gonna try to say the names because I'm terrible at names, but I'll put a little screenshot down below so you guys can see. So her question was, or comment was, my issue is when the doctor is working on the side I am on, I don't know where to put my section. So this is very typical. I've worked with dentists that are very mindful of me and try to, give me room for the suction. And I worked with some dentists that I'm trying to search for a spot to sneak my suction in because they're just all up in that mouth. I can't get in there. And what I've learned honestly is if I can't get my suction in there because they're on my side, I'll hover it outside the patient's mouth, and then the dentist will kind of get the hint that you can't get in there if you don't want to say anything, and then they'll usually move for you or something like that. And they're gonna move because obviously they're gonna notice that the patient's mouth is filling up with water. So they're gonna get out of the way so you can suction. And there are times too where my suction just can't fit into the patient's mouth, and my dentist, will do some work and then he'll pull out, let me suction, and then he'll go back in. But yeah, I just hover it outside the patient's mouth so he kind of gets the hint that I can't get in there. Because if you can't find a way in, you can't find a way in. There's nothing you can do about that. So that's just what I do. Now, this was a comment too. It says, it amazes me how many of us are or were treated like trash. I thought it was just my work. Quitting dental assisting was the best thing I did for myself. And this makes me really sad because, I'm not gonna lie, I'm gonna be completely honest with you guys. There are some dentists and dental offices that are not fun to work for. And there are some dentists that don't treat their staff very well, but I think that can happen in any profession. But dental assisting is very difficult because you do work, directly with the dentist, and you're doing a lot for that person. And when you don't feel appreciated, or you don't feel like, you're being noticed, or, they're not treating you with respect, that can be really hurtful, especially because we do so much. And I just want to say, if you are feeling that way, I hope you don't think that it's the profession, and if you don't like dental assisting, then that's completely fine if you want to do something different. But if you truly love dental assisting like I do myself, find an office or a dentist that best works for you. I worked with a dentist that I absolutely loved working with. We were best friends, and then he actually moved out of state, and I had to go find another dentist to work with. And I've worked with dentists that were just completely awful and disrespectful, and that I just hated to work for. And it does take some time. You're gonna hop around from office to office until you find a good match for yourself. But do not work with someone that you feel is disrespectful. Leave that place respectfully, but go look somewhere else. I just hope you guys don't take it out of the profession if you do truly, truly love it. It just may take some time to find your perfect office, or, it might not even be a perfect office. You might really like the dentist, but you don't click with some of the assistants. You might think the dentist is okay, but you love the assistants, just somewhere where you're happy. But yeah, that does make me really sad, Hannah. But I hope you're happy now, and I hope maybe you found something that you feel respected in, or you weren't treated like trash. That's really sad. Okay, so this is another comment. It says, so do all cavities eventually lead to a root canal, or can you maintain a cavity for a lifetime? Well, mine is getting them replaced from breaking down if you brush well, so you never need a root canal. All right, so not all cavities eventually lead to a root canal. A root canal happens if the decay has reached the nerve or the pulp chamber of the tooth. So it's a very large cavity. You can have small fillings. They're not going to get larger unless, you know, you don't take care of your teeth, or you're not flossing, or you're not getting them replaced, you know, if they're broken down or chipped or leaked. As long as you maintain your teeth, they're not going to lead to a root canal. You only need a root canal as if that decay reaches a nerve of your tooth. But that's it. So even if you have a filling, it does not mean you're going to need a root canal. So this was a comment, and then someone actually responded to it as well, but I was just going to bring it up. It says, I have a question. I'm thinking about going to school to be a dental assistant. Do dental assistants have to get shots every year like the nurses? And you don't need to get shots every year. I'm not sure what nurses need to get, but yes, you're gonna need shots before you start working in a dental office. You're gonna need like your Hep B, you're gonna need your TB, your like tetanus. Some places do require a flu shot. There are vaccinations that you're going to need. I don't know about yearly. I know tetanus is like every 5 to 10 years, I think. There is one that's every 3 years, and I think that's the TB. But yeah, you are going to need vaccinations before doing that. So this person just asked, why do you have to get an associate's degree as a dental assistant? I'm a dental assistant, and dental hygienists have associates where I live. So again, every program's different, every state's different, everyone's different. The program that I went into, you just had to have an associate's degree to graduate with your dental assisting certificate. So that's why I have my associate's degree. But yeah, you don't have to have your associate's degree to be a dental assistant, and hygienists can have their associate's or their bachelor's degree. A lot of us hygienists do have their bachelor's degree, but you can have either one. You can even be an assistant with a bachelor's degree. Whatever you want to do. It's just my particular program, we had to have our associate's degree to graduate because I went to a community college and that was just their requirements. Another question, it says, I'll be an assistant next year, but what happens when you are pregnant and when do you go on maternity leave? So I don't have any children, so I've never been pregnant, but I have worked with some girls that went on maternity leave, and usually the most common thing is you get 12 weeks off. At this office I'm in right now, you get 12 weeks of maternity leave, and then you get paid for only 6 weeks of leave, temporary disability that you file for. So the first 6 weeks are unpaid, and then the last 6 weeks you get paid half of your wages. Another office I've worked in, it was 12 weeks off, and you had to use PTO. You had to save up your PTO. It was unpaid maternity leave. It just depends on your office. Some places will pay you, some places won't. I think the smartest thing that I heard one of my friends do is she got AFLAC, which is an insurance, and she went on maternity leave and she actually got her whole entire maternity leave paid for through AFLAC. I'm not quite sure how that all works out, but just look into your possibilities. I know you can file for temporary disability on your own if you want to do that. If you work somewhere that is not covered, try to save up PTO if you have that as an option, or look into some kind of insurance like AFLAC. Here's another really good comment that I found. It says, your nails are so pretty. Thank you. Do you get them done often with your line of work? I'm just going to answer each question as we go here. I used to get my nails done often. I used to get gel polish on my nails, but it was really expensive, so I don't do that anymore. But I just paint them myself. A lot of offices don't like nail polish. I'm saying so much. I'm sorry. A lot of dental offices don't like nail polish, but they will allow gel polish. So I usually would do that, but recently I've just been painting my nails. It's only been the last few months, but I really wanted some for the summer, so that's what I've been doing. But yeah, a lot of dental offices actually don't let you have nail polish, unfortunately, but they will have you, or let you have gel polish. So then they said, what's your favorite part of dental assisting and your worst dislike, if you even have one, working as a dental assistant? It's a good question. There's a couple things about dental assisting that I really, really like. With my personality type, I like to be very structured, and I feel accomplished when I kind of have like a checkoff list and I can just mark things off as I go. And with dental assisting, it's a lot like that. I mean, you set up your room, you grab your patient from the lobby, you seat them, you do your chart note, you do your procedure, and then you clean up your room, and then you can kind of check that patient off. They're done for the day, and then you can move on to your next one. I really like that. At the end of the day, I feel accomplished. I can see exactly how many patients I've seen or helped with, and to me, it just makes me feel like, okay, checked off, moving on to the next. And I just really like that. I feel very organized. I also just find it really, really interesting. I love taking the x-rays. I love looking at the x-rays, looking at the root or what's underneath the bone or the tissue. I just find that all very, very interesting. And I love being able to help people and making them feel comfortable in a dental situation. A lot of people have a fear of it, and I love when they leave and they're like, oh, this was the best experience I ever had, or you made me get over my fear of being at the dentist. That makes me feel really, really good. I try to be really compassionate towards people and make them feel comfortable and let them know that they're in a safe place. And yeah, that just makes me feel really good. So it's probably my two favorite things about dental assisting. I think it just works really well with my personality type. My least favorite part about dental assisting would have to be sometimes not getting the respect that you feel that you deserve. If it's, you know, from patients that might not give you respect because you're not a dentist, other staff in the office. You know, I've worked with receptionists that can be a little disrespectful, or it seems like they have a lot of respect for the dentist and they would never say certain things to him, but then when it comes to you, they are kind of talk back to you or can be disrespectful. And I'm not the type of person, even in whatever position you're in, I will be respectful towards you and talk respectfully towards you. I have never, you know, done your job or anything like that, so I'm not going to assume that you have it easy or that, you know, I could do it better. And I feel as an assistant, there are times that you can be disrespected because you're not in that higher position. And that kind of sucks. There definitely is a totem pole in dentistry, and it's, you know, dentist, hygienist, assistant, and then like office staff. But for some reason, there's this like gray line with assistants where people think they can just kind of boss them around and be disrespectful, and that's tough. That's probably my most dislike about being an assistant is not getting the respect that we all deserve, and that we should get just for being, you know, human beings. But once you find an office that works for you and that you feel respected in, you know, stay in that office. And it can take a while. Like I said, I've worked in multiple offices. I've liked more than others. And if you're not happy there, just leave. And that's what I've always done in the past. And it kind of sucks because you can be kind of floating around from office to office. But if you're not happy, don't be there. But yeah, it's a shame that sometimes assistants don't get the respect that they deserve. Because we are smart, we know a lot, we do a lot, and yeah. We want respect just like everyone else. He said that, I'd like to get more info about your opinion on the health hazards of working as a dental assistant, like carpal tunnel, back pains, neck pains. Yes, 100%. It's a tough job, especially the position that you're in all day. And I don't think a lot of people realize that unless you're an assistant or a dentist or a hygienist, and I'm just talking about the dental field. I know, you know, nurses and everything else, I'm sure that they have the same type of issues. But as an assistant, it is your job to cater to the dentist. So you want the dentist to be comfortable, and you're kind of just like morphing your body into whatever to you know, get around the dentist or suction or hand them things, and it's tough. You're constantly holding something, you know, you have your hand like this for I don't even know how many minutes a day. You're handing instruments, you're holding stuff with like your pinkies and your thumbs, and you're hunched over. And a lot of patients too, especially when you see older patients, they can't be leaned back all the way, or, you know, they have to have their head tilted up, and it's hard on your body. It's hard to be bent over in those positions or hunched over. You're definitely going to experience some things. I just did in a video with my friend Kathleen. She's been a dental hygienist for 23 years, and she has always told me, you know, if you can only work 30 hours a week, do it. She recommends it to hygienists and assistants and anyone. She's like, work 30 hours a week because it's tough on your body. And she's actually having to get a hip replacement, and I'm sure there's other factors into that as well, but it is definitely very tough. I've worked with an assistant that had to go have carpal tunnel surgery. We all complain of back pain. It's very common. Dentists complain of back pain. It's just awkward positions all day, every day for long amounts of time. So it's very hard on your body. Very, very hard. Well, I hope you guys enjoyed this video, and please leave me comments down below and I'll try to answer them when I can, or, you know, send me messages and I'll try to answer them. Or maybe I will do another video like this in the future and try to answer some more questions. But thank you guys so much for watching this video. I hope you found it helpful, and I'll see you in the next one. Bye guys.